And perhaps the best news we have heard during the pandemic is the success rate of the vaccines. Of course, now the big question, getting those vaccines to the public. UW Health's Chief Quality Officer, Dr. Jeff Pothof, joins us once again now. And thank you for always enlightening us on this, Dr. Pothof. We appreciate that. First question, do you anticipate some Wisconsin residents getting this vaccine before the end of the year?
I think it's very likely that before Christmas, some Wisconsin residents, most likely healthcare providers, will be vaccinated. It's just looking like the timeline's coming together pretty good right now.
That's good to hear. Now, what about people who might want to choose which brand of vaccine they take? Is that a good idea? And will people be able to do that, Dr. Potoff?
I think all of us are very competitive, and we're going to look at different vaccines. As some saying they're 95 versus 94, and probably lean towards trying to get the best vaccine. That's probably not the optimum strategy. All of these vaccines that are coming out, they're all proving to be highly effective, very safe. The winning strategy is to get a vaccine that's available to you where you're at. So probably less likely this idea that you'll be able to pick which one you get. But when one gets close to you and you're offered it, that would probably be the right one to get.
Yeah, the efficacy rate is amazing. A lot of people say they want to still wait before getting a vaccine to make sure that nothing serious pops up over the next year or so. Now, do you think that thinking is warranted on behalf of people who are feeling that way?
I can understand how people want more assurances that the vaccine is safe and effective. I think the thing that moves my judgment to the idea that getting the vaccine is the better option is that COVID-19 is just a really bad disease, and these vaccines collectively have now been evaluated in hundreds of thousands of people with very few, if any, major adverse events. Very good efficacy. If I was going to bet, man, I would bet on the vaccine being a better option for me and my health than getting COVID-19.
And you got the first vaccine, I think the AstraZeneca vaccine, and any side effects that you can tell us about, or how you doing?
No, I mean, as far as I know, I haven't gotten COVID yet, so that's a plus. But other than some real mild symptoms that first night after I had gotten the vaccine, it has been completely fine, no problem at all. I give it a thumbs up. I'd recommend it for anyone considering to get a vaccine to go ahead and do that.
Well, we appreciate you being, quote, a guinea pig for the sake of science and the rest of us. Dr. Jeff Potoff, UW Health, thank you very much for joining us this afternoon.